Welcome to the Vet Dental Show. I'm Brett Beckman, board certified veterinary dentist, and we bring this podcast to you every Wednesday as a veterinarian, as a technician, as a dentistry team to help you be even better at veterinary dentistry in your practice. We're sponsored and partnered today with the Veterinary Dental Practitioner Program. If you're interested in being among the best anywhere in general practice as a team in veterinary dentistry, I invite you to request an invitation. Just go to ivdi.org/INV, like invitation, first three letters INV. So IVDI, International Veterinary Dentistry Institute, ivdi.org/INV, and we'll get you the information that you need. Hi, and welcome back to the second episode of the interview with Annie Mills, LVT, VTS in dentistry. If that's obviously ideal, what is an approach that a general practice can take if they are in a situation where they want to do dentistry, they don't have maybe all of, or let's take out the equation. Let's say they don't have all their equipment yet, but there have been appropriations to get their equipment, and that dentistry service is being built from the ground floor. What are a couple of things that practice can do now to prepare and maybe have some type of actionable steps that they can do while they're in that process? Because I know there's a lot of practices around the world, around the US and in Canada, especially from our standpoint, because we listen to them at our seminars and we know where they're at and we know their struggles and frustrations. So that being fairly common, what can they do in the interim that would have a lot of impact before they get all that technology put in place and ready to go?
Well, absolutely. Education, that's a good time for staff to delve into dentistry and attend seminars, live seminars, virtual seminars, online seminars. There's so much education out there, and really start getting into dentistry and building your knowledge base. And that's kind of another reason we recommend in general practices, depending on how big your staff is, keeping the dental team small and concise so that we find who those dental superstars are, the ones that are passionate about dentistry and want to learn about dentistry and want to improve standard of care. Because we know dentistry is one of those services that staff members either love or they're just not crazy about. And so identify those staff members that really are passionate, and ideally, 2 to 3 technicians and 2 veterinarians is a really nice combination to form a small dental team and put all our CE money and expense into those staff members and get them trained correctly so that when that equipment comes online, X-ray primarily, and then your high speed and getting those oral surgical techniques down, learning the regional nerve blocks, learning the X-rays, looking at pathology, all of that kind of prep work, so that when your dental suite is together, you've got some knowledge base to jump in and start. And there's always, that we're still learning. There's new changes in dentistry every day, but education is absolutely the key, along with the correct equipment in your dental suite. And minimum requirements, X-ray, high speed, and good staff. Absolutely.
That brings up another really good point. Right now, very difficult in the veterinary field to find good uh, available and when I say good, I mean dentistry trained individuals that can just be hired easily to come into the dentistry service. What are some of the avenues that a general practice could tap into to be able to find those kind of people, or is there anything out there?
Well, as far as staffing, definitely the VTS network. We are in the hundreds now. For a long time, there's only about 40 or 50 of us across the country. There are now over 100 VTS dental technicians across the country, and if that's something that you want to incorporate into your practice, that is a huge asset just because of their knowledge base and what they can bring to your dental department with regards to not only your patients but your staff. Just having that boots on the ground right in your clinic, that's a huge wealth of knowledge for your practice. And I remember when I achieved my VTS, I was still living in Michigan, and that was 2008. I was actually the only one in the state of Michigan. And our practice actually marketed me as part of their dental department, the only practice in the state of Michigan with this credentialed dental technician in their dental department to help promote that our staff is highly trained and highly specialized in dentistry. And so those folks are available, and the avdt.us, Academy of Veterinary Dental Technicians.us is the website. And there's, contact people on there. There's, if you want to put a job posting on there, we have a site to support all of that if you're looking for a VTS for your practice. That's what I would recommend. It's a lot easier to get a hold of a VTS to come in if they're looking to get into a practice to really ramp up their standard of care and ramp up that dental department, then getting a boarded dentist to come in. That's typically not, that's more challenging, I think. And VTSs, I think, are more accessible, provided the job is a good fit for them as well.
Excellent. One question that I have, if you are putting yourself in the place of the general practitioner and you personally had to go back and do one thing over again that you may have done that you not necessarily regret but would change, maybe that, I guess I should clarify that by saying, aside from coming on and working with me, but one thing that you would change from a general practice standpoint that you think would benefit from our veterinarians and technicians that are in general practice that are starting dentistry or getting to the point where they're maybe even ramping up their dentistry service?
Yeah, I think the one big thing that comes to mind, I can remember when we did dentistry without dental x-ray. And there's a lot of practices still doing dentistry without dental x-ray. And knowing what I know now, doing dentistry without dental x-ray and then doing dentistry with dental x-ray, I could absolutely never go back. And I wish we would have had dental x-ray a long time ago. And some of these patients 10, 12, 15 years ago that we're seeing these little dogs, and by the time we get to them, we're extracting everything because there's so much disease in there. And had we known better years ago and promoted differently and assessed early with dental x-ray and could find stuff early, these 10, 12, 14-year-old Yorkshire Terriers may still have most of their dentition still in place. And so I think a lot of patients suffered just because we just didn't know any better. And dental x-ray was one of those keys in just turning the light bulb on and finding that early pathology that you would never ever find without it, because these patients are never clinical. We don't trust our patients. They will lie, and there can be all kinds of stuff going on in there, and these patients tend to suffer in silence. So to prevent that, let's find this stuff and treat it so that these patients can have much better quality of life.
People in general practice, vets and techs, are frustrated many times as they go through that journey. What is the number one takeaway that you can provide for them that puts them back into some hope that this journey will get better if they stick to the training, stick to the dentistry service, and really put in the effort that it takes? What is the what kind of encouragement can you give them under those circumstances?
Number one, take the pressure off of yourself. It is about quality, not quantity. A lot of practices try to do so many patients in a day, and they're just under such a time management crunch that I think that's where a lot of frustration and anxiety comes from. We've got so many procedures to do, and we've got to cram them in between this and that. Our main recommendation when you're first starting out, no more than 3 patients in a day, and make those patients, evaluate those patients, do a cursory oral exam, and we're not going to want to do 3 13-year-old Maltese in one day. That's 3 perio cases. That's a full day. So maybe, stagger those cases, but no more than 3 in a day. That's it. And then when you get, your skills become more honed, your speed picks up. Eventually, you're going to be able to add cases, but take the pressure off of yourself in trying to get so many patients done in a day. It's not doable if you're doing dentistry the way it should be done. If we're just anesthetizing patients, cleaning their teeth, and waking them up, unfortunately, that just doesn't have any benefit for the client. That's more or less taking your car with engine trouble to the car wash. And so we're just not having that benefit for our patients, where we're assessing, treating, and then prevention moving forward. And in order to do that and allow the time, 3 patients tends to be a good number. And depending on your practice, maybe it's only 2 patients. And then you work towards adding to that schedule. And so take the pressure off of yourself and remember that it's quantity or quality, not quantity. I think that's the number one thing I would think of.
That pressure may be felt from external forces too. Is there a way that we can maybe help to prevent that going forward? Is there a specific conversation that needs to be had to make sure that everybody's on board with that setup?
Yeah, dentistry is one of those services that just can't be rushed. And so it may, be where you have to have an adult conversation with the practice manager or the practice owner. And, dentistry has to be approached based on what we've learned and how dentistry should be done. This is what our approach needs to be, and we need to have the support to be able to do dentistry this way. And so we need to allot time. We need to maybe just, if we could have just a day of no other surgeries besides dentistry, you may be able to fit in a few more cases, but that the rest of the staff is kind of on board in promoting dental x-rays. And some of these cases could be 2.5 hours long. That's just oral surgery, even in our practice. And Dr. Beckman is probably one of the fastest oral surgeons ever. He can extract a canine, maxillary canine or mandibular canine in 15 minutes or less, skin to skin. So Our cases are even 2.5, sometimes 3 hours, depending on what that treatment plan is. And with perio, which is what the majority of your caseload is going to be, those cases take time. And so we need to have the support to, not be rushed, not be pushed to, you got to hurry up with this case because we've got a spay to do. You've got to see appointments, in 10 minutes. That kind of pressure is just not going to be helpful, and it's going to have less benefit for those patients.
Excellent, Annie. Well, I can't thank you enough for coming on today and sharing all that with the general practice dentistry service, the vets and the techs that are out there in the trenches trying to get this done and do it for their patients. So where can people find you? Where is where is a place, maybe an online place where they can see what you do and get more information about you?
Veterinarydentistry.net is the website with our seminars and what we have to offer, not only for veterinarians, but technicians as well, and different levels of courses, depending on where you're at and where you need to start. Everywhere from beginner to intermediate to skilled, we offer education to cover all of that. And with my courses specifically, I'm available live, virtually, and online demand seminars as well. So there's a lot of different avenues out there to get the education, depending on where you're at in the world and what your budget is. We try and accommodate and get the education out as best we can, and reach a lot of folks that way.
Excellent. Well, again, I can't thank you enough for coming on. Hopefully we can get you back at some point in the future later on. And thanks for coming in, and keep doing what you're doing in the field.
Absolutely, my pleasure. And I hope this was helpful for those of you that are listening, and we can provide great standard of care for all of our dental patients. Thanks so much.
Thanks, Annie. I hope you enjoyed that episode. If you'd like more information about the Veterinary Dental Practitioners Program, please submit to request an invitation at ivdi.org/INV.